This is Dr. Annette Smith at the Bailey Small Animal Teaching Hospital, representing the Oncology Service, and this is the Talk of the Town.
Dr. Smith, talk to me a little bit about the Oncology Service at the Bailey Small Animal Teaching Hospital.
So the Oncology Service, we generally see about 3,000 patient visits a year. Many of those are new patients that are coming in for initial diagnostics and to find out what their treatment options are. And then many of them are also going to be patients that have ongoing care, either continuing chemotherapy or potentially monitoring for any tumor recurrence or any tumor spread. We have a team approach here where we have both a radiation oncologist, a surgical oncologist, and a medical oncologist that are going to be involved in managing all of our patients so that we can figure out what the best treatment option is for each individual animal, as opposed to having just kind of a cookie cutter approach. We always want to make sure that the other parts of the team are also involved, which is the primary veterinarian, who is the general practitioner that does routine care, as well as the client, the pet owner. They obviously know their pet better than anybody, and they're going to know what their pet is going to, how their pet is going to respond to treatment. And with that team approach, hopefully we are able to achieve our goal of helping any of our cancer patients live longer and better lives during the time that they're being treated.
Is there a huge difference between animal cancer and human cancer?
Really not. When we think about it, animals actually are a really good sentinel or a good model for human cancer. They live in our homes, and so they're exposed to the same things that we are. They generally live for a longer period of time when they live with us in our homes, which means that they have the opportunity to develop cancer because that's a disease of older pets, just like older people.
I'm Dr. Thomas Passler. I'm a member of the Farm Animal Section at the J.T. Vaughn Large Animal Teaching Hospital at Auburn University.
So tell me a little bit about the farm service, the farm animal service at the J.T. Vaughn Large Animal Teaching Hospital.
Janet, we have 4 different services. You're currently in what we typically call the beef or farm animal hospital, in which we treat beef cattle, in which we treat very small ruminants, sheep and goats, llamas, alpacas, and sometimes we see pigs. We don't see as many pigs as we used to, but this hospital in which we are sees mainly beef cattle, from small producers, large producers, hobby producers to commercial and purebred producers.
And tell me about a number of cases that the service sees on a typical year.
Typical year we see approximately 1,500 cases, sometimes a few more, sometimes a few less. We're very proud of that. We are amongst the top 2 farm animal hospitals in the country, have been number 1 for many years, then give up a place to another university hospital I won't name, but we're up there. We have a very busy caseload, and we're very proud of that and try, of course, to cultivate that.
And talk to me about what the mission of the service is as far as education of students.
Yep. So we have 2-week-long rotations. We have typically around 7, sometimes up to 9 students on each rotation, and we have 4 rotations in the Farm Animal Hospital. They get hands-on training. That's the whole goal of their 4th year in veterinary school, hands-on training. A lot of these students have not grown up on the farm. That's changed over the years. So they actually learn maybe for the first time to touch a bull or a cow, how to move the animals. And then of course more the common procedures they learn.
What are the most common procedures that you're seeing?
That's a hard question to answer. We see a whole variety we see lamenesses, we see a lot of surgeries, a lot of internal medicine cases, a whole lot of different cases.